Hi guys, welcome back to our channel. And in case it's your first time here with us, my name is Dr. Balta, Clinic Director here at Neck and Back Pain Specialist. So today we're going to be talking about lower back pain. And we get a lot of patients that come in and wondering like what's causing your lower back pain? What's causing their lower back pain? So what is it actually that's causing the lower back pain? That's what we're going to talk about today. There's so many causes, but the ones that we see the most here in our clinic are these seven. I'm going to go over these seven causes of lower back pain. Okay. So the first one, and that's a common one that we see here in our clinic, and it's that degenerated disc. Okay. So what happens is a normal disc is about this height, and you got to think of your disc. It's like basically spacers between your bones, and so these keep the bones from rubbing against each other, and also creates that hole right there where the nerve comes out from there. Okay. Now, what happens is when the disc starts thinning out, as you can see here, then it's almost like bone on bone, and also the hole gets smaller. So not only are the bones touching each other now, but the hole gets smaller, so you have a pinched nerve. So you get narrowing of the nerve opening, and that gives you a pinched nerve, and that's going to give you a lot of pain. Now, on top of that, too, because it's almost bone on bone, that's going to cause a lot of problems in that area too, a lot of inflammation, swelling, and it's also going to cause problems in the joints back here, and that's going to give you pain because it's going to be inflamed and anything is going to irritate it. And just to show you what that looks like on a model, this is a healthy disc space. This is an unhealthy one. And as you can see, the hole where the nerve comes out from here is nice and big because the disc space is keeping it open. And then over here, it's thinning out, and therefore you're getting the pinched nerve in that area. You're also getting a lot of bone spurs right there, and that's a formation of abnormal bones that they're over there, and that eventually could fuse together, and then so there's no movement in your spine. So that's called degenerated disc. Another name for that is called DJD, and basically the reason it's called disc degenerative disease, which stands for disc degenerative disease, is because it's very progressive, and if it's not taken care of, it just keeps getting worse. It's like a tooth decay. If you don't catch it early, it just keeps getting worse, and eventually it fuses together, and then it becomes bone on bone. Okay, so it's almost like having your brake pads in your car getting thinner and thinner and thinner. Eventually, every time you put your brakes on, what's going to happen? You hear it screeching. You're going to hear it like making that noise. Well, same thing here. That's what happens is the bone starts getting closer and closer to each other. Eventually, it's going to be a bone on bone, and eventually it'll fuse together, and that's not good. Okay, so that's the most common cause of lower back pain, degenerated disc. On the next video, we're going to go over the one that we see here a lot in our office, which is a subluxation. So stay tuned for our next video. We'll be talking about subluxation, and that's what we see here in our office the most. That's what causes most of the lower back pain in our office that we see here in our office. All right. Thank you guys for listening. And as always, please subscribe, and please follow us on TikTok, Instagram, Facebook, and any other social media. We're all over there under Neck and Back Pain Specialist. And for more tips and more information about our clinic, please always follow us and look out for our next videos. Thank you, and I'll see you next time.